Hi everyone, Dr. Simal Soin here from AAYNA Clinic. I'm going to speak today about hair loss, something that troubles most of us at some point during our lives. It's almost like the bane of our aesthetic issues that we face, got particularly worse during the COVID time. So let me first of all talk about the different kinds of hair loss. First of all, there is telogen effluvium. Telogen effluvium is stress-related hair fall, which can happen after, of course, mental stress, but any physical stress or trauma to the body. For example, after a viral infection, a typhoid fever, like in COVID, the amount of hair loss people faced was absolutely crazy. People came by the hordes to try and address their hair loss issues. It was really just stress-related hair fall, telogen effluvium. Then we've got androgenetic alopecia, which can be male and female both. Male is obviously commoner and it's physiological, which means it's hereditary, genetic. If your father has it, your grandfather has it, your paternal uncle has it, your maternal uncle has it, your mother has it, or anybody in the family, there's a huge chance of you getting it. And that typically starts with bitemporal recession and thinning on the crown of the scalp, and it's progressive. So unless you intervene or do things about it, it's just going to get worse with time. So again, 20% of people in their 20s, 30% in their 30s, 40% in their 40s, 50% in their 50s, and so on and so forth will have hair loss, male pattern hair loss. Female pattern hair loss typically manifests as less common than male pattern baldness. Again, hereditary, also related more to polycystic ovary disease, to thyroid conditions, will manifest as diffuse thinning in the scalp. You'll see a much widened central parting. Then the other ones which are more related to conditions, autoimmune conditions, are in the alopecia. Alopecia areata, which is, there is bald patches which just happen suddenly one fine day in the scalp. So that is autoimmune in terms of the body's own cells start attacking themselves. Then we've got alopecia totalis, universalis, where because of the same conditions you could lose hair completely in the whole body. Then we've got traction alopecia, which is something that you see commonly in people or cultures where they actually draw the hair back and do a very tight bun or braid their hair back. So that's as there are other different kinds where you can have scarring and you can have fibrosis, but these are the main common ones that we typically encounter. So what do you do about hair loss? It's important for you to remember that do not take over-the-counter treatments. Make sure that you see your dermatologist to figure out your treatment options, because you could be needing, and there are a lot of, there are the drugs like minoxidil, the original drugs, and finasteride, which are approved, FDA approved for use for various skin conditions. But of course, you need a doctor prescription for that. But apart from that, there are now many new modalities which have come. So when you treat hair loss, it's important for us to have a topical treatment, which means that you've got to use something in your scalp. You've got to have an oral supplement, because it might be because of some kind of a deficiency, which we will try and figure out. And you've got to maybe have a treatment like a PRP or an injectable treatment. There's a new treatment called QR678, which we all do now, essentially to improve the microcirculation of the scalp with the use of growth factors. So topical plus oral plus a injectable treatment. Hair transplant is of course another story. That is a lot, great results even with that. But while you have that treatment, especially in men, good results in men for androgenetic alopecia, not for any other treatment. So at AAYNA, we offer multiple treatment options for you and give you a very wholesome and holistic plan for your hair loss. Please remember that one size does not fit all, especially where hair treatments are concerned. So come visit us and let us make you a perfect holistic plan for your hair concern, and make sure that you have healthy, nourished and luscious hair.